Hi there, my name is Marwa Hassanain. I'm a student at the University of New England, and I just completed an IRB proposal on the subject of vitamin C and osteoporosis, which I'll be presenting today. So the purpose of this study is to prove the effectiveness of vitamin C on bone mineral density, specifically observed in physically active adult females who live with osteoporosis. Because physical activity actually slows the progression of bone loss, making it an essential part of any osteoporosis treatment plan. And also, vitamin C enhances collagen synthesis, which has a direct effect on improving bone mineral density. The nutrient of concern in this study is evidently vitamin C, and just to provide a quick overview, it is otherwise known as ascorbic acid, and it is a water-soluble vitamin, meaning that it is easily absorbed into the body and is ready to be used almost immediately. However, it's not naturally made in the body, and therefore it cannot be stored, stressing the importance of intaking this vitamin on a daily basis, whether through diet or supplements. This vitamin is also very popular in the skincare realm, often seen in serums and creams and lotions, promoting healthy skin. It's also widely known for boosting immunity in commercial products such as Emergen-C or Airborne, which claim to combat the common cold. And also, obviously, vitamin C is known to be abundant in citrus fruits, especially oranges, and grapefruits, lemons, limes. Other sources of vitamin C in the diet can be strawberries, cantaloupe, broccoli, bell peppers, Brussels sprouts, and potatoes as well. A little more about vitamin C is that it's a powerful antioxidant, meaning that it defends the body against harmful free radicals that could cause disease or cancer, and it is essential for collagen synthesis. And collagen is a structural protein that is found in connective tissue. It provides firmness, flexibility, elasticity to skin, teeth, tendons, and bones. And it is especially useful when these tissues are damaged because it can accelerate the healing process. The disease that will be discussed throughout this research proposal is osteoporosis, which involves the deterioration of bone at a faster rate than its production, resulting in a significant loss of bone mass and density. This also leads to the weakness and fragility of bones, making them vulnerable to breakage. Osteoporosis can often go unnoticed since those who have it are asymptomatic, that is, until they experience the pain of a fracture. This disease can certainly get to a severe point in which the bones become even weaker as a result of improper treatment. A slip in the kitchen or even a really big cough or sneeze could cause a fracture in severe cases. And it is commonly conceived that only older adults or elderly can have osteoporosis, when in reality, children as young as 8 years old can have this disease as well. So one is typically diagnosed with osteoporosis following a DEXA scan, dual energy X-ray absorbed geometry, which will give the patient a T-score and a Z-score. So the T-score is a comparison of one's bone density with that of a healthy 30-year-old adult with normal healthy bones. And a Z-score is a comparison of one's bone density with that of an individual of the same sex, age, and body composition. And a T-score is more commonly used in diagnosis, and one that is of negative 2.5 or lower is indicative of osteoporosis. So the literature review followed a thematic structure, beginning with studies involving vitamin C administration for osteoporosis, and these studies generally concluded that although higher vitamin C levels were associated with lowered risks of osteoporosis, that more research needs to be done on this topic. And this led into studies done on the effects of physical activity on osteoporosis, which generally concluded that specifically weight-bearing exercises such as walking and stair climbing are the most beneficial. And this then led into studies done on osteoporosis amongst female athletes, concluding that the risk of this disease increases with the intensity of the sport, especially when the athlete is not properly nourished, which leads into the studies done on the effects of nutrition on female athletes, concluding that proper nutrition is essential for optimal athletic performance, which then lastly led to a study done on the correlation between vitamin C, osteoporosis, and physically active older adults, which concluded that those who had higher vitamin C levels had a reduced risk of osteoporosis symptoms such as fractures. So the research question for this proposed study is, does daily vitamin C supplementation increase bone mineral density in physically active adult females with osteoporosis? The null hypothesis states that there is no correlation between increased vitamin C levels and bone mineral density in physically active adult females with osteoporosis. And the alternate hypothesis states that proper vitamin C intake can improve the bone mineral density of physically active adult females with osteoporosis. This proposed study will follow a true experimental research design, classified as a post-test only control group design, due to the fact that there will be two groups, an experimental group that will be treated and a control group, and both groups will be tested after interventions. And the study will also be a quantitative data analysis based on the results of DEXA scans as well as blood tests. The DEXA scans will provide T-scores for bone mineral density, while the blood tests will provide milligrams per deciliter of vitamin C in the blood. So this study will ideally have 128 total subjects. This was determined by the G-Star Power software through the a priori two-tailed t-test, in which the ratio between the experimental and control group will be 1-to-1. Therefore, there will be 64 subjects in each group, and up to 256 women will be recruited for this study. However, only half will be included in the final sample. So subjects will be selected to participate in the study if they fulfill the following inclusion criteria. First, they will need to be female and at least 45 years old, since this is when women may first see signs of menopause, and the lack of hormone production can increase the occurrence of osteoporosis. They must also be residents of New Jersey, since the research will be conducted in this state. And they must also already been diagnosed with osteoporosis with a T-score of -2.5 or less, and must also be physically active, preferably with some sort of athletic background, whether that means they played sports growing up into their young adulthood or have stuck to an exercise routine for the past 10 years, which can include yoga, Pilates, or even weightlifting in the gym, and will be excluded if they do not meet these following criteria. So there will be 8 gyms across the state of New Jersey where the subjects will report to in groups of 16. There, they will meet with a certified personal trainer and engage in supervised physical activity for 1 hour, 5 times a week for 16 weeks. This will total up to 80 hours of training throughout the study. The sessions will consist of both aerobic and resistance exercises, beginning with a 15-minute walk on the treadmill at 2.8 miles per hour speed, then 30 minutes of various resistance exercises, ending with another 15-minute walk at 2.5 speed. All subjects will engage in the same exact physical activity, determined and once again supervised by the personal trainers. But the experimental group will be treated with vitamin C, and they will be supplementing 500 milligrams every day of the study. And every 4 weeks, all subjects will complete DEXA scans and blood tests at facilities that are local to them, for a total of 4 DEXA scans and 4 blood tests during the study from each subject. After interventions and the results of the DEXA scans and blood tests come back, the researchers will expect the T-scores to improve, looking for anything between negative 1.4 and negative 2.4. Although higher scores would be great, this is just a more realistic expectation for this particular subject group. And for the vitamin C levels, the researchers will be looking for higher levels than 1.0 milligrams per deciliter, and will specifically look for the highest values in conjunction with the T-scores in order to establish a positive correlation. And all the data will be inputted to an Excel scatter plot, which will allow the researchers to observe the relationship of these two variables. Consent and confidentiality are both very important in order to protect the subjects, which is why consent will be obtained fairly often. It'll first be obtained during recruitment by the research team, where they will witness the subject's date and sign the consent forms, and then at the start of each training session, which will be witnessed by the personal trainers, and at each appointment for DEXA scans and blood tests, which will be witnessed by the facility staff. All consent forms will be electronically scanned into password-protected flash drives, organized by the date. And the results of the DEXA scans and blood tests will be reported to the researchers in the absence of identifiers, aside from the year of birth. This is so that the researchers may draw conclusions from collected data based on age if they need to. Also, HIPAA privacy rule will always be abided by, and the subjects will have contact information of the research team in the case that they have any questions or concerns. Although the subjects are already physically active, the risk of getting injured in the gym during the training sessions is possible. They could experience muscle strains or fractures, which is why the trainers will be supervising them the whole time, ensuring that they are maintaining safety and proper form throughout all their workouts. And the benefits of the study include the possible discovery of a new treatment for osteoporosis. If the experimental group prevails with improved bone mineral density, then all subjects will be made aware so that they can implement this supplement into their treatment plan. And also, they will be completing DEXA scans and 80 hours of certified personal training for free, which is certainly an advantage. The expected results of this study are that increased vitamin C intake will improve bone mineral density, ultimately reducing the risk of osteoporosis-related fractures. This is due to vitamin C escalating collagen production, which will be used to repair damaged bone tissue and make bones denser. And the intervention of structured weekly physical activity will allow bones to adapt and therefore prevent further bone loss. Feel free to go through my references throughout this slide and the next. And I greatly appreciate the time you took to watch this video, and I hope you enjoyed my IRB proposal.